Hi, my name is Dr. Joshua Levinger. I am a physician at Medical Center Hospital, and this is Ask a Doc. What is an otolaryngology specialist? An otolaryngology specialist is a doctor who treats problems of the ear, nose, and throat, but it's just easier to call us ENTs. We can treat problems in the office, in the hospital, or in the operating room. In fact, it's one of the oldest medical specialties, and doctors were performing ear surgery as early as the 17 and 1800s, before antibiotics and anesthesia was even discovered. What kind of conditions do you treat? ENT specialists treat a wide range of problems of the ear, nose, and throat, head and neck. They can be simple problems or severe problems, and we treat patients of all ages and all stages of life. We're medical doctors that can treat your sinus headache. I can treat your child's swimmer's ear and your dad's sleep apnea. We're also surgeons. We can take out tonsils for strep. We also take them out for things like sleep apnea. I can correct your deviated septum and clean out your sinuses to help you breathe better. In the ear, we treat things like earwax and swimmer's ear and toddler ear infections, hearing loss, ringing in the ears, vertigo, foreign bodies, things stuck in your ears. In the nose, we treat congestion, allergies, sinus infections, deviated septums, nosebleeds. In the throat, we treat tonsil infections, strep throat, snoring, sleep apnea, hoarse voice and swallowing problems. I'm having trouble breathing through my nose. What should I do? The treatment of nasal congestion depends on the underlying cause. You can try over-the-counter nasal sprays like Flonase or Nasacort or Nasonex. Start with 2 sprays each side every day. Sometimes the sprays work quickly, but usually they do take a few days to a few weeks to kick in. And if you still have congestion and the sprays aren't helping, you should make an appointment to make sure you don't have a chronic sinus infection or nasal polyps or allergies or a deviated septum, and I can help you figure that out for you. Can I be overusing my nose spray? You certainly can be overusing sprays, especially the ones like Vicks spray or Afrin. The generic names for those are oxymetazoline and phenylephrine. These sprays cause rebound congestion, and so what that means is when the spray wears off, your congestion is actually worse than when you started. You can become addicted to these sprays, and they can cause actually some quite serious damage to the inside of your nose. They should not be used on a regular basis, and certainly not more than 3 to 5 days in a row. They're really only best used during the worst days of a head cold. Other sprays like Flonase can dry out your nose. They can cause scabbing, thick mucus, and nosebleeds. These side effects are usually caused by directing the spray towards your septum, which is the bone and cartilage that separates the right and left side of your nose in the middle. To use Flonase, you first want to gently blow your nose and clear everything out. And then when you place the tip of the nozzle into the nostril, aim it slightly away from the middle, from the septum. Give it a squirt, and then sniff it in. And then repeat the process depending on how many sprays you're using. How can I know what allergies I am prone to? Millions of Americans suffer from allergies. Allergy symptoms include sneezing, nasal congestion, runny nose, postnasal drip, watery eyes, itchy eyes, ears, nose, and throat. Symptoms are triggered by exposure to the particles in the environment, in the air, and they're called allergens. And allergens are proteins that trigger an abnormal immune system response when breathed in. They're found in dust, in tree, grass, and weed pollen, molds, animal danders. Typically, trees pollinate in the spring, grass pollinates in the summer, and weeds pollinate in the fall. And so if you have seasonal allergies, then you'll have more symptoms during those times of year. Something like dust allergy is typically all year round. We can test your skin or your blood to determine what you're allergic to, and then how to best treat those specific allergies. What can I do for seasonal allergies? There are 3 broad ways to manage your allergies. The first is avoidance. pollutants. If you know what you're allergic to, then you can take steps to try to avoid and reduce your exposure. And so this is really where allergy testing comes in handy. Testing is either done by placing concentrated forms of the allergy on your skin or through a blood test. And the results of the allergy test can help us counsel you on ways to avoid exposure to what's causing your symptoms. For example, people with a dust mite allergy can put allergy covers on their pillows and their mattresses. You can wash your bedding frequently, avoid carpets, and use special room filters called HEPA filters. Medications are the second way to manage your allergies and reduce symptoms. Antihistamines like Zyrtec and Allegra should really only be used for occasional mild allergy symptoms. The nasal sprays like Flonase are more effective than the antihistamine pills to treat all of your symptoms, especially if you have symptoms every day. They're safe for anyone over 2 years old and even long term, as long as you have an ENT to follow you and make sure that you don't have any bad side effects from the treatment. Finally, allergies can be treated with something called immunotherapy. That's what we know as allergy shots or allergy drops. If your allergy symptoms are not getting better with avoidance and medications, or you're having side effects from the medications, then we can give you small doses of what you're allergic to and slowly increase the concentration over time. And after about 6 months or a year, you'll start to see improvement in your allergy symptoms, but it probably takes 3 to 5 years to actually get lasting results from immunotherapy. I experience frequent sinus infections. Is that normal? Sinus infections cause congestion, increased mucus production, discharge, sore throat, low-grade fevers, and cough. There are different types of sinus infections. An acute sinus infection can last up to 4 weeks. Chronic sinus infections can last 3 months or longer. Recurring sinus infections happen at least 3 to 4 times a year or more with no symptoms in between. Most sinus infections are caused by viruses. The common viruses are rhinovirus, parainfluenza, influenza, and coronavirus. A viral infection, when it starts, it typically gets worse over the first 3 to 4 days, and then starts to improve by day 5, and by day 7 or 10 is usually gone. Many people ask for antibiotics early in the course of the infection, and when the body naturally fights off the virus, they assume that the antibiotics were the reason for getting better. But this actually has caused an overuse of antibiotics and has contributed to growing antibiotic resistances. About 2% of viral sinus infections turn into bacterial infections. A bacterial infection is more likely if you have symptoms like fever, sinus pressure, headache, toothache, ear clogging, in addition to the other symptoms we just mentioned. A bacterial sinus infection usually will last longer than the typical 10 days of a viral infection. Or you can start to see an improvement in your symptoms from the viral infection, and then it gets worse again after day 5, and that's what we call the double worsening. And that's also likely to be a bacterial sinus infection. Usually a 10-day course of antibiotics will treat a sinus infection, but if you have more than 3 to 4 infections a year, or if you have a sinus infection that really continues on after trying 2 different courses of antibiotics, you should see an ENT. My snoring is keeping my partner awake. What can I do about this? Snoring is produced when the soft tissues of the throat vibrate during sleep, usually when breathing in. It's very common. It's seen in adults aged 30 to 60. About 44% of men snore and about 28% of women snore. If you snore, ask yourself these questions. Is your snoring loud enough to be heard through closed doors? Do you feel tired, fatigued, or sleepy during the day, like falling asleep while you're driving? Has anyone seen you stop breathing, choke, or gasp while you're sleeping? Do you have high blood pressure? Are you overweight? Is your shirt collar 16 inches or larger if you're a woman, or 17 inches or larger if you're a man? Are you a man? And are you older than 50 years old? If you said yes to any of these questions, especially 3 or more of these questions, you could be at risk for something called obstructive sleep apnea, or OSA. OSA happens when the throat collapses during sleep and the breathing is reduced, either partially or fully, throughout the night. If you have sleep apnea, you could be treated with a machine called CPAP, and that will also treat your snoring. If you're low risk for sleep apnea, or you have a sleep test that determines you don't have sleep apnea and you just snore, then there are some treatment options available as well. Sleeping on your side helps. Some people will actually sew a tennis ball into the back of a t-shirt and wear it so that when you roll over onto your back at night, it becomes uncomfortable and forces you to move back to your side. Anything sedating at night will worsen snoring, like sleeping pills and certain medications. Alcohol will absolutely make snoring worse, and so try to avoid drinking within a few hours of bedtime if you snore. Losing weight is going to help with snoring. If your nose is congested, treating it with nasal sprays or the Breathe Right strips will also help. The nose is only a small part of the snoring equation. The tongue and the palate are usually the main offenders. So a dentist or an oral surgeon can fit you with a custom oral appliance that pulls your jaw forward, which then pulls your tongue and your soft palate forward and decreases snoring. And there are also some office-based procedures that we can do on the tongue and the palate to improve snoring as well. What can I do to clean my ears? Too much earwax can cause ear pain, clogging, hearing loss, ringing in the ears. It can cause itching, odor, discharge, and even infection. And so you can clean the opening of your ear canal with a soft cloth or a tissue. Just wrap it around your finger and just go like this. And that's really all you probably need to do to clean your ears. But never put anything like a Q-tip into the ear canal. Q-tips often just push the earwax deeper in the ear canal, making the problem worse. There are over-the-counter wax softeners and irrigation kits, but these also can allow the earwax to fall deeper into the ear canal. If you have a lot of earwax that causes symptoms like itching or ear clogging, hearing loss, then you should probably just see an ENT. I'll clean it out for you with small instruments or a little vacuum. And if you're prone to earwax, then you should probably see an ENT every 6 months or once a year, just for routine cleanings, just like you would when you go to your dentist. Once your ears are clean, you can use baby oil or olive oil. 1 drop in each ear a couple times a week will help thin out the earwax and just promote natural, healthy self-cleaning of the ears.